Hi, y'all. My name's Emma. I'm with the Campaign for Southern Equality, and this is just going to be a quick recap recorded version of the Alabama town hall that we had last night. All right. All right, so I'm going to start out by just giving a quick overview of SB184, which is the ban on gender-affirming care for transgender youth in Alabama. So SB184 prohibits gender-affirming healthcare in Alabama for people under the age of 19, including gender-affirming surgery, hormone therapy, and puberty blockers. The law allows for criminal felony penalties to providers of gender-affirming care for people under 19. Youth in Alabama can still access mental health care, which is not restricted or banned by SB 184. Additionally, it's important to note that prescriptions for medication can also still be filled in Alabama, as pharmacies are not governed by SB 184. This bill passed the legislature back in April 2022, and it's currently not in effect, which is also important to note. So, litigation challenges. SB 184 took effect for 7 days in 2022, but it was then blocked by a court order in a case filed by the Southern Poverty Law Center, National Center for Lesbian Rights, and the Legal Advocates and Defenders and Human Rights Campaign, who are joined in litigation by co-counsel King and Spalding LLP and Lightfoot Franklin and White LLC. Sorry, that was a mouthful. A hearing on the plaintiff's motion for a temporary restraining order and preliminary injunction took place on May 5th, 2022, and days later, a federal judge halted the law from being enforced. So essentially, it was in effect for a few days in 2022, but then it wasn't enforced after that. Then fast forward to now on August 21st, 2023, following a November 2022 hearing, the 11th Circuit Court of Appeals reversed the federal district court ruling blocking the ban's enforcement. So the ban is not currently in effect as next steps are determined in the case, and families can still access gender-affirming care in Alabama as of August 24th. So here's just some key points about gender-affirming care in Alabama for trans youth. So despite the 11th Circuit order on Monday, the ban is not in effect right now. It's likely that that will be the case for at least 2 months or more as the court decides the next steps. There's also a chance that the ban never even takes effect. In the meantime, though, speak with your provider as soon as possible, consider asking for a new prescription, and take steps to be prepared just in case the ban does go into effect in Alabama. So now I'd love to take a minute to talk to y'all about the Southern Trans Youth Emergency Project, which is a project of Campaign for Southern Equality in partnership with Prism United and Magic City Acceptance Center in Alabama. So it's a program that's been launched across the South to provide resources and guidance to families impacted by anti-trans healthcare bans. Yeah, and it's just a really important program since 90% of trans youth in the South live in states where anti-trans healthcare bans have been passed. So in Alabama, trans youth can access several different resources through the Southern Trans Youth Emergency Project, including patient navigation. So families can reach out to us and we can help them contact providers in states where gender affirming care is legal and connect them to care. We have emergency grants of $500 to support youth with any immediate needs. That could be travel expenses, mental health, wellness needs, really anything that a family might need. There's no restrictions and there's no income restrictions either. Anyone who's impacted by the law can access that. We also have frontline grants for local organizations who are working with trans youth, and generally just trying to create an ecosystem of care, and that can include like providing accurate information about the laws, like through town halls. Yeah, so if anyone has any questions about any of this, please feel free to reach out to us. You can reach out to Adam Pulaski at adam@southernequality.org, and he'll connect you with someone who can answer your question. Thank you.